Dr. Brandon Money, the golf doctor, here to discuss number 4 of the top 5 golf shoulder injuries. And at number 4, we have labrum tears. And labrum or labral tears are very common in individuals, whether they have symptoms in the shoulder or not. And upwards of 70% of people have been shown to actually have labral tears with or without any symptoms of the shoulder. And tears of the labrum can also affect the stability of the shoulder itself, and we'll get into more on that in just a moment. All right, so a little anatomy lesson first. And so the shoulder itself is a ball and socket type joint formed by the humeral head, which is the upper part of your arm bone above the elbow, and the glenoid cavity. And so the labrum itself is a ring of fibrocartilage that wraps around the glenoid. Now, I want you to think about the shoulder as a golf ball that sits on a sideways golf tee. The labrum is kind of like a rubber gasket that helps wrap around the rim of the head of the golf tee, which helps increase the surface area, which can help with stability of the shoulder, making sure that that golf ball stays on the golf tee itself. And this is particularly important during movement because that ball wants to move around a little bit more as we do any movement with the shoulder, and that can certainly help with stability. Now, a little bit about labrum tears themselves. They can come from trauma, such as if you dislocate the shoulder or pop it out of socket. That can damage the labrum itself, which can lead to recurrent instability of the shoulder. We have these structures called ligaments that act like pieces of duct tape that help stabilize joints. And so laxity of those ligaments can create instability of the shoulder. If you have certain swing characteristics and poor mechanics of the golf swing, that can increase stress in the shoulder and certainly create injury. And then also that repetitive motion, particularly repeated overhead movements, maybe associated with a job or recreation, that can injure the labrum of the shoulder. Now, some key symptoms include history of a previous dislocation or recurrent dislocations or subluxations. Subluxation is basically almost a dislocation but doesn't fully pop out. Pain deep into the shoulder, or perhaps you have catching when you try and move your shoulder, particularly overhead. Now, as far as diagnosis is concerned, there's usually some positive clinical tests on a comprehensive physical exam. In addition, the gold standard would be to get an MR arthrogram, which is essentially an MRI that's performed after some dye is injected into the shoulder itself. Now, treatment options, we start conservative with everything, includes rest, activity modification. I recommend seeking out a Titleist Performance Institute or TPI certified golf expert physical therapist or movement specialist. And TPI certified experts, they know the golf swing and how it relates to how your body moves overall. Now, as we advance into interventional treatments, there's corticosteroid injections that are done to decrease inflammation, which are not recommended by me because high doses of corticosteroids performed in a traditional orthopedic and pain management setting can actually slow the healing process down and potentially worsen injuries. Now, orthobiologics such as PRP or platelet-rich plasma and bone marrow concentrate can help promote tissue healing and repair. Now, at the furthest end, surgical management, you can repair or remove damaged labrum tissue. Also, in conjunction with that, a biceps tenodesis is often performed where they cut the biceps tendon and then reattach it elsewhere, usually further down the arm. And so some final thoughts, and just because you see a labrum tear on an MRI or just because a radiologist reports it, that doesn't necessarily mean anything. Lots and lots of individuals walking around have labrum tears and they don't even know it because they've never had any symptoms associated with their shoulder, and so they've never gotten any imaging or even brought it up to their doctor. And so you need a comprehensive exam to really determine what's causing your symptoms and what's really going on in and around the shoulder itself. And as always, start conservative, work your way up. Surgical options really should be a last resort if other treatments fail. All right, golfers, now you know the insights about shoulder labrum tears. Look out for the next video coming soon, number 3 of the top 5 golf shoulder injuries.